Welcome to InCast. Enjoy Health Education's podcast for dedicated healthcare professionals, educators, and administrators who are passionate about making a difference, encouraging healthy outcomes, and finding innovative ways to engage and empower new families and staff. Here's your host, Debbie Young. She's been a childbirth educator and doula for almost 30 years and came to Enjoy based on her love for educating families.
Thanks again for joining us. Today, we're focusing on a topic that touches every parent we work with: coping with stress in a world that feels increasingly uncertain. From global conflict and community tension to lingering vibrations of anxiety left behind by the pandemic, expecting and new parents are carrying more emotional weight now than ever. And as professionals who walk beside them, we have the opportunity and, in fact, the responsibility to help them feel grounded, supported, and empowered. To help us navigate this important conversation, we're joined by someone whose wisdom, compassion, and decades of clinical experience make her an extraordinary guide. Gabrielle Kaufman is a dance movement therapist and a licensed professional clinical counselor with over 30 years of experience. And for more than a decade, she served as a clinical director of Maternal Health Now. Prior to that, she led New Moms Connect groups at the Jewish Family Service of Los Angeles, supporting new parents, especially those experiencing symptoms of postpartum depression. Gabrielle has taught for Arts and Healing Initiative, Drexel University, Postpartum Support International, and brings a deeply integrative mind-body approach to perinatal mental health. She also is bilingual in Spanish, and so she is expanding access care for diverse families. Thanks for being with us today. We're so thrilled that you're here.
Thank you so much. I really admire the work that Enjoy does, and it's always a pleasure to be with you.
Is there anything else you want our listeners to know about you before we get started?
I think maybe the only thing you didn't mention is that I'm a mom myself, and that I had a difficult transition as well. And in this day and age, when my kids are much older, I'm still navigating life stressors and challenges and looking at how that impacts me and my family. So just kind of, I think always to remember that most of us in the trenches, in the work, are also experiencing a lot of the same things.
Right. Which may or may not be helpful, as we'll see as we go along. So,
yeah.
Pregnant and new parents are navigating stress from all of these things. How, as perinatal professionals, how can we help families recognize how much of this stress may be impacting their childbearing year? And in fact, I wonder if people are just deciding not to have babies because of all the stress in life right now.
That's a very interesting question. How does it feel to bring a baby into a world that feels uncertain? And even whereas in the United States, we do live with relative peace, we are seeing upheaval, we are seeing political divide, we are seeing fear of ICE and deportation in the communities that are struggling, kind of with fear and how fear impacts that. So, that question of, are people making this decision whether or not to have children and to bring them into this world? I think that's a relevant question. But I think in the communities we're looking at who are choosing to bring children into the world, they're feeling everything. I think about this global unconscious, right? Mm-hmm. That we're all bathing in this soup of thinking about these political experiences, economic strain, going to the grocery store and everything is more expensive.
So true.
And people are losing jobs, and they're always, in and out of losing jobs. But right now it feels really intense. And there is anybody who's had a prior trauma in their life. I think a lot of the news cycle right now is inflaming that. I can't help but think many of the moms that we work with have been victims of sexual violence. And we are hearing a lot in the news about sexual violence.
Right, for
So
sure.
I think these are just real issues, even concerns about reproductive privacy and reproductive choices and struggles that families are dealing with. Despite where we may be, it's still tense. And I think so. The question you ask is really a good one. What can we do? And I think the first thing I would say is to be able to name that issues are prevalent right now. When you are in a room, whether you're teaching a class or you're working with individual families, to sit and to say to them, what have you been feeling? What has been kind of on your minds and in your thoughts and in your day to day? And to ask and to make it normalized to say things are more stressful than usual. One of the things that we say, there's a kind of phrase in psychology that we say is to name it is to tame it, right? It doesn't feel as big if you can share it and name it.
Mm-hmm.
That doesn't mean you or I have to fix it, because I can't fix a global conflict. I wish I could, but I can't. But what is there in naming it? We just normalize that this is real and that we're all going through it, including you and me.
Right. That's a great point. And I think sometimes we need to think about how we can help parents differentiate between that external stress we've been talking about and maybe the stress that's coming internally because of the unknowns of pregnancy and early parenting. And these parents are probably dealing with both sides of that. So how can we help them differentiate?
That's a really important question. And I think it's really hard at times when we are in it. I really like to think about changing perspective. If you look at a situation from a different perspective, I mean, literally get up and move to a different side of the room and think about a situation that you're in. Does your perspective change?
Mm.
And if your perspective changes, then maybe you feel a greater sense of power and control.
Huh. I like it.
Yeah, it's a simple thing. I mean, there's something I will do sometimes with the patients that I work with, and I'm like, stand up, let's get up, take a step back. You're too close. You're too close to an issue. I mean, we're always too close to an issue, especially if it causes a great deal of stress and worry. And stress and worry is its own impairment for judgment.
Mm-hmm.
So we're struggling with judgment because we're too dang close.
And it feels like it snowballs. Like, you're like, can't get out of that loop. So.
Yeah, absolutely. I like to tell people, like, if they're having a thought in the middle of the night, most likely it's not a logical thought. We don't get logical judgment at 3 a.m. All we get is worry. And you know what? I had somebody just tell me today that she couldn't sleep because she didn't remember if she put the money from the tooth fairy under her baby's pillow or not.
Oh no. Oh no.
That's like a perfect example of like how we get wound up with something so small, but that feels so monumental in the middle of the night.
Yeah. Yeah.
So if you can get perspective, it helps us to differentiate whether this is an internal stress or an external stress.
Mm-hmm.
And then the other thing I like to say is we can't control everything. So what if we were to change our thinking to say, what about this situation? Can I get some?
Mm-hmm.
Can I get my arms around? Right? I can't. Yeah, it's snowing pretty badly all over the place right now. I'm in LA. I won't tell you it's not snowing here, but we can't change the weather. But we can bring food in to get us through this difficult time when we might not be able to get out of the house. We can dress warmly when we go outside, right? So look at what we can do, not what we can't. Look at what we can control, not what we can't. Because circling the drain of what I can't control is a futile exercise that only perpetuates and snowballs, like you said.
Well, and that makes me think that the people that we're working with, the pregnant people that are coming to class or we're becoming their doula or the new parents doula, they're in it. it's not a decision they're making now. They are doing this thing.
Yes, they are.
So, how can we talk about them when they bring up that the worry they have for bringing the baby into this world? Is there any language or any way that we can reassure them or help them feel grounded rather than overwhelmed in the path that they're taking?
So there's an approach in psychotherapy we call strengths-based. What are your strengths? How have you gotten through difficult times before? Reach into those pockets.
Okay.
You know, who is your team? Like I like to say, let's like gather that team together and say, these are the people who are going to be in my corner. And that's there. I know that I sleep better if I have a cup of chamomile tea at night. So I'm always going to have a cup of chamomile tea at night. I know again, and the other thing I wanted to say about, birth can be really scary. It used to be that we would talk about making a birth plan, but the birth plan is a setup because I got to tell you that baby never reads the birth plan.
Right?
So a couple of years ago, the March of Dimes came out with what they called birth preferences. And that language changes everything, doesn't it?
Yeah.
It's not, this is the plan and it's going to go this way. And if anything diverges from that, all hell breaks loose. No, these are my preferences. I would prefer to labor for this amount of time with this, support system. I would prefer to be talked to this way prior to an epidural. I would prefer, whatever those things are, name them. And then I always want us to empower people to ask and also tell it when they're in a medical setting to be able to say, I need you to stop and explain again because I don't understand.
Yeah. Yeah. And, interestingly, I didn't know that about March of Dimes, but Enjoy, probably about 10 years ago, changed the birth plan concept to a birth preferences plan, still being able to, like, I always talk about it like taking a trip. You have your map or you have your phone set to go from point A to B, but if there's an accident, if there's bad weather, all these things can make you divert, and preferences over plan is a good deal.
It is. It's such a good deal. I'm glad that you have that. And that surprised me that you're on top of that. I think this is another thing about the parenting journey is expectations versus reality. I actually see people really struggle with depression because their expectations are unrealistic. That doesn't mean you should say to somebody, don't have expectations, but just to say, okay, we have expectations and we have contingency plans. How can we look at the whole picture?
Right. That makes, and what things can we give parents to help them feel grounded besides that? Are there magic words that we should have that help them stop feeling overwhelmed? I don't know.
Well, the one thing that doesn't work is to say, just relax, Debbie.
I agree, 100%. Yeah. Yeah.
So that doesn't work. But I do really believe that the mindfulness approaches and techniques can be incredibly helpful. So one might just be simply put your feet on the ground, take off your shoes, be barefoot, put your feet on the ground. If it's not freezing outside, put your feet in the dirt. There is science that says connecting to dirt is grounding in a literal way for us to feel safe and connected to something bigger than ourselves. There's box breathing, which is the idea of, inhale for a count of 4, hold for a count of 4, exhale for a count of 4, hold for a count of 4. And you follow that. And there are these beautiful, you can find little videos. Those things are amazing. I also think just kind of being in the moment and finding things to connect to. So what are 5 things you see? Well, I'm looking at your screen right now. I see the exercise ball and the plant, and I see the poster, and I see the bookshelf, and I see, and then what are 4 things that I can smell? Well, I'm smelling the flowers, I'm smelling somebody's cooking, and then go through all of the senses. What are 3 things I hear? What are two things that I can touch? And what's one thing I can taste? And if you just go through that list of those sensory things, all of a sudden you check in and you're like, oh, I'm not so much in my head, I'm back in my body.
And I love that too, because it makes it local to the parent. If
Mhm.
we could do it with them, if we're with them, like on a prenatal visit,
Mhm.
we could do that with them to show them how they can bring the bigness out there to be what they're doing, what they're creating. So I
Yeah.
love that technique. So very good.
Really is. And I wanted to kind of even reference more. The more that we model and do something with somebody, the more that we say, you're not crazy. This isn't just you. This is a tool we all can use. And normalizing, it takes away stigma, but it also helps people feel less lonely because this journey can feel lonely.
Yeah, yeah. And we're modeling it, like you said, so they see how it works because we're doing it with them. Yeah.
Yeah.
I think about the concept of uncertainty in the birth world, especially for first-time moms. I have a group of parents I just finished teaching last night, and some of them don't have anybody in the area. They don't have a social support system, and they're feeling a little like they're in a silo doing this thing by themselves. And I think that uncertainty on a certain level is fine, but being able to be say, I don't know what's going to happen. I've never had a baby before. I don't have the people around me that I wish I did have around me. um, Rather than having all of those things churn inside of them, is there a way that we can help them tolerate that or accept that rather than fear that and move forward?
Oh, such a powerful and real situation. Being able to tolerate discomfort is one of the things that we are often not taught, you know?
Mm-hmm.
So how can we tolerate some amount of discomfort? And then the other thing is you were talking so much about isolation. And I think we're in a day and age where there are so many electronic ways that we can stay connected with people. They're not ideal.
No.
If I really want to be with a friend, I don't want to see them on a screen or call them on the phone. I want to touch them.
Mm-hmm.
But in lieu of that, find an online support group.
Okay.
Postpartum Support International has a bunch. Many other places have them. Find an affinity that you have with somebody else and see if that connection can open a new door. Just because we have kids in common doesn't mean we have anything else in common, but maybe that's the first step.
Yeah.
And then the other thing I'm like, I think we have to become able to tolerate in ourselves being able to ask for help.
Yeah, for
I think
sure.
that's a really big deal. A lot of people, I mean, you're a caregiver, I'm a caregiver. I'm like, people come to me, I'm a giver. I'm used to being the giver, but we have to be able to shift and say, I can be a taker. And once you can exist in that idea of being a taker, then all of a sudden you are more relatable, but also you are modeling for your children. And then the last thing I'll tell somebody is you can be a taker today and a giver tomorrow.
Mm-hmm.
Look at it as a pay it forward plan.
Yeah.
I am really needing support now. I need community now. I need to feel a sense of belonging and I want somebody to take care of me. And what that means, taking care of me might be, come and make me dinner, or could just mean send me a text every day and ask me if, I'm okay.
Or chamomile tea, right? We could bring you some chamomile tea.
Exactly, whatever it is.
Yeah.
And then conversely, recognize how good it was to receive, and then find the way when the opportunity presents and you are feeling better to give back.
Mm-hmm. Mm-hmm.
It's very empowering.
And the wording that you were using, giver and a taker, I kind of like giver and receiver.
Much better.
Yeah, yeah, because taker feels like "Nyeh, nyeh, nyeh, nyeh,"
Uh-huh.
and receiver is like, bring it into me. Just my own thought.
It's a very good one, and I agree. I think in some ways our brains go to, that's the only other alternative. I'm a giver or I'm a taker, not a receiver. And I think you're right. It is about receiving, but also, I mean, when we can change that thought process from taker to receiver, there's something really beautiful about that too.
You're right. And I think that birth workers and doulas can help in that process. I think we can help frame the unpredictability of what's happening in their, their birth, in their childbearing year, and help them feel like there's a manageable part of that toward their birth or toward bringing that new baby home.
Yeah.
What do you think?
I do too. I really agree. I think there are things that are manageable and things that are manageable with others and things that we may need to farm out. You know, I think so much about individuals who don't have a strong support network. And what do you do about that? I mean, they might be new to a neighborhood and they don't know the people in that neighborhood. Their family may be far away. They may speak a different language. They may feel very culturally distant or shunned. So what do? We help them to be creative. What are the avenues that are open to them, and saying, who is there for you? Is there a next door neighbor who might be nice and friendly and open? Is there a faith community that you can reach into? Is there a school that might have individuals, or reach out to professionals? Right. I mean, in lieu of the connections that may feel more organic, professionals are here. And I know that those of us who are right now enjoying this conversation, we are all carers. We all care.
Yeah. Yeah. And that's why I do this work, and probably you too. Absolutely. Because we care and we want to be part of the solution. And speaking of that, last night I told you there were a couple of couples in the class that didn't have anybody around. I said, look to your left, look to your right. Exactly. Here are your new friends. There's a bar right down. No, I'm just teasing, but and they liked it. They said, oh, we're not alone. Here are some people.
I mean, my daughter is 26. I met a friend of a friend who gave birth around the same time as me, and we still see each other. We're still friends. I mean, it's not as regularly as it was before, but we still do. We still have that connection. And I think what a gift that was, but also I wouldn't have made it through that year without this friend.
Yeah. Because we do need each other. And, whether it's a childbirth educator saying, here's people that you can connect with, you can build your own clan, or whether it's a doula, listening to their story and helping them understand, oh, that person you just talked about might be the perfect person to do this or that, and just bring them in.
And we may need to give suggestions.
Yeah, for sure.
I also want to say, if they're in a partnership, it may not be that partner, and that's okay. It may not be your spouse. Your spouse is lovely and can serve a lot, but maybe your spouse is going through something too.
Right.
And it doesn't mean your relationship is in trouble if you need more than one person in your life.
100%. And I think that sometimes we forget that the partner, the spouse, the dad of the baby is having their own stuff. And as a postpartum doula, I am there for the whole family. And that's a unique gift that I can give to them.
And so needed. And when we think about whole family care, we have to involve everybody, siblings, as well.
They get left out a little bit. So I used to bring gifts for the little ones, but that's not really something I can do anymore.
But even just looking at dad and saying, I see you. How are you doing? Can I give you a cup of chamomile tea? Right. Can I, the focus is always on the baby or baby and the mother, but looking at that father, that partner, that, that other person is often holding up so much. and
Right.
maybe struggling themselves. And just a little TLC, I think what is the greatest thing I do in my work is just be present and hold.
Mhm.
That's really the most important thing. How are you holding space? I probably don't have most of the answers. I certainly cannot fix most things, but I can tolerate your struggle.
Right. Right. And I think sometimes we forget that they probably have a million questions they don't feel like they have the right to ask.
Yeah.
And so if we are there normalizing the ambiguity of starting a new family, we can just put it out there to them too, right? Hey, dads, you're included in this conversation too.
Yeah. And you've got questions. And I am not going to tell you I have all the answers, but I will tell you I will help you find them.
Mm-hmm. Yeah. Yeah. Doulas are queens of referral for sure. So,
My gosh, I think we all need to have our referral deck.
yeah. Yeah. I think one of the things that is kind of hard still, I'm sad that it's still hard in our culture, is that many parents believe seeking mental health support is a sign of weakness. And I think that educators and birth workers need to have some sort of an understanding of how to portray that it's not, that it's a sign of strength, that it's a gift. How can we go there?
Well, I think first of all, we do have to name that mental illness gets a bad rap. In many communities and many traditions, it's taboo. We don't talk about it, we don't acknowledge it, or that person's just being lazy, right? Can't they just try harder? You tell somebody who is really deeply depressed, I don't understand why you're not doing more with your day. And what we're saying to them is that we have no compassion for their struggle. And the truth is, for somebody in that deep, deep depression, getting out of bed may feel to them like climbing Mount Everest feels for us.
Mm-hmm.
It's
Yeah.
that big. So the first person we need to start with is ourselves. I would invite everybody to think for a moment, what messages did you receive about mental illness as you were growing up? And what have you learned that's different? And I want us to remember that mental health is health. So if I am not feeling good with my mental health, my entire physical health is also going to be impacted.
Mm-hmm.
So we look at whole body health and whole body care. And we also know that somebody who is struggling with depression, for example, through pregnancy, they're less likely to show up for their prenatal visits, right? They're really struggling.
Yeah.
They might be less likely to follow child safety recommendations or, taking their child to their well child visits. So what we have to recognize is it's all part of a bigger system. And once we can own our bias, and we all have them, then
Sure.
we start to address it.
Mm-hmm.
And then the next thing we do is we normalize and we say, all of us have feelings, and sometimes those feelings really impact us. And if those feelings impact our ability to function, that's when it's good to talk about it and get support. And to let everybody know there isn't a single way. Yes, we know the gold standard for depression is psychotherapy and medication, but that's cookie cutter. And we don't look at people as cookies, right?
Right.
We want to really look at them and their individual needs. So meet them. What has worked for you in the past? Have you ever talked to anybody? How do you feel? Would you feel comfortable joining a group and talking in front of others, or would you feel more comfortable one-on-one? Would you feel more comfortable talking to your pastor than you might to a psychologist? Would you feel more comfortable talking to another mom or a health educator? Find the person who you feel is going to open that first door.
Mm-hmm.
And this person has to know, you or I, we have to know our limits. Like, oh, okay, this is working, but the symptoms are so great, I can't handle them on my own. But I don't disappear. I make a warm referral. I help them get to that next level, and I continue to provide support, containment, and care until they're able to transition.
That's such a good point, because we can't have all the answers. but we can walk beside them as they're seeking their answers.
Yeah.
Yeah.
And nothing worse than feeling like somebody has disappeared on you because they think your problems are too big for them.
Mm-hmm.
Because what you're telling them is, I'm too much. I'm too much. I can't handle you. You're too much for me. That's not what you mean to say. You mean to say, I want to get you the right help. But that doesn't mean that's the way it's interpreted.
Right. And I think that's a good point, because as like working with families in their home, as a postpartum doula, I will not be leaving until the end of my job, right? And even then, I just got a call from somebody I worked with about a year and a half ago, and she said, "This is happening in my life." And I said, "Shall we get tea?" And she said, "Yeah, we should get tea." So the trust that's built by the provider to that person in kind of this less formal situation than like your doctor or your midwife can be even better, I think.
What you did by saying, I think we should get tea, is you said, you matter.
Yeah.
Here.
Mm-hmm.
I still remember you and I'm here for you. Even if that doesn't mean I'm going to come every day. That
Right.
just means you you matter. And I think ultimately that's all we really want. We want to know we matter.
Right. For sure. For sure. Um, a while back when we talked, I don't know, it was a few weeks ago, you shared an example of an individual who was trying to, like, struggling with sleep or something. And she said she couldn't go to sleep, and she had been given all of these different ways to help her get to sleep. And the thing that I heard you say is, I asked her, "Well, how did you usually go to sleep?" And she said she watched TV. And he's like, "That's a good solution." Um, how can birth workers connect the clients back to what was working for them before they had their babies or before they were pregnant? Because this isn't a new life. Like, they haven't moved to Mars. What worked for them before is probably going to work for them now. How can we do that?
Absolutely. So one of the things that we can really do, this goes back to strengths based, and also really that phrase, so what worked with you for you before? Like, how, I like to ask the question when I'm doing a training. I'll say, what are the ways that you do self-care? Now, you would be shocked to hear the things. Some people, like, I like to walk my dog, I like to paint, I like to talk to a friend. And then somebody else was saying, I like to watch Real Housewives. I'm like, that stresses me out. But if that's what you like, what are the things that we like? And we do it on this individual basis.
Mm-hmm.
So finding those avenues that work for each of us. So that phrasing is perfect. What has worked for you in the past? Now, if they say to you, it's not working anymore, okay, well, let's think about, can we use that as a starting point? Okay, you used to watch TV, but now that's too difficult for you. So what about something like watching TV? Can you watch a movie instead? Can you read a book? Can you read, whatever it is? I mean, look, I'll be honest, when we look at, there's an approach to helping people with insomnia called CBTI, which is cognitive behavioral therapy for insomnia. And what they really do is look at sleep habits. And one of the sleep habits you don't want to have is watching TV before you go to bed. But if it works, if it ain't broke, right?
Right. Yeah.
So go with what works. There's an app, a web-based app, the MyCare app from Maternal Mental Health Now. I think you have the link to it, but I will make sure you have it to share, where individuals can go through and create their own care plan.
Mm-hmm.
And they can go through, I'm pregnant or I want to get pregnant, and they go through and create their own care plan that gets emailed to them. It's free. It's just a resource. But I think I created that many years ago when we were looking at what can we give people to feel like they have something. We all like to walk away with a tool, don't we?
Mm-hmm. Yep. Especially nowadays, if I could put it on my phone, then there you go.
So I have a tool, I have a list. there are wonderful apps out there that are now being created for suicide prevention. And one of the things that they basic, like kind of the basic template for it is, who are your first calls, right? Who are your resources? What are your reasons for living? What are your distractions? And, if you're really having a hard time, what works for you?
Mm-hmm.
So I think it's in the same way. I think it's always important to say suicide is an important consideration, because the rates of suicide in this perinatal period are higher than other times in
Yeah.
life.
Yeah.
So,
It's one of the highest reasons that moms don't make it. So, yeah.
so don't be afraid to ask about it. You don't have to fix it. You just have to tolerate if someone is struggling and say, wow, thank you for being honest. Thank you for telling me. Let's see what we can find, because I know that you deserve to live, that your baby needs you, and we'll get there.
Mm-hmm. Mm-hmm. Yeah. And that's a tough conversation that you really need to stay close with them while they're finding the right referral.
Absolutely. You need to hold on.
Yeah.
Absolutely.
Yeah.
And again, you don't need to fix it. You just need to be able to have the hard conversation to get them to the next place.
Mhm. Yeah. And I think sometimes our society wants to give all the do's and the don'ts instead of encouraging them to find their own coping mechanisms and their own methods for moving forward. And if they can't, if they're that stuck, then we can offer 3 or 4 choices and they can see which one of those is the right one.
And
Right.
the word you said that was so important is choice, right? People like to feel a sense of autonomy and choice, even at their deepest, darkest place.
Yeah.
Feeling like you have choice is feeling human,
Right.
right?
Right. And nobody can tell you what to do in your life because they're not living your life. They're not in your shoes. So knowing, yeah, the choices are really important. You had mentioned earlier about some people are going to want to do one-on-one care. Some people might want to do a support group. And I did just give the reference for PSI to somebody who I don't know, but I met her husband and he said she was struggling and she lived very far away from me. And so giving her resources that I have in my area would not have been helpful. And I went to the PSI website and I saw maybe 30, I'm not kidding, 30 different groups that cater to different lifestyles, different thought processes, all of that. And she called me back. She said, "Thanks for doing that. I know I'm not in your area, but I think I found a group that's going to work for me." So I'm like, it worked. So,
Postpartum Support International does extraordinary work, really amazing. Their website, which is postpartum.net, has lists for support groups. You're right, like different populations, different needs, different languages, for moms, for dads, for expectant moms, for people perinatal loss, like all over the place. And the groups are led by really wonderful, well-trained specialists. So really amazing. The other thing the website has is there's a directory of people who have gone through training, and there's a certificate that you can get if you've passed the exam. It's a board certification. So the perinatal mental health certificate, which is really wonderful. So you can find people all over the world, not just even in your country.
and that makes me think that some people who are listening today may say, I think that would be helpful for me. And so now they know where they can go to find out more about that is postpartum.net. And if this is something that they want to learn, just want to learn more about, or if they want to be certified, they can add that to their alphabet soup at the end of their name. So,
And if they want to just be a volunteer, PSI has volunteers in every region. There's a warm line you can call and they answer. And they also have this wonderful resource, which is a psychiatric consultation line. So if you don't have a doctor in your area who specializes in perinatal medications, you can have your physician call their line and talk to somebody to get a consultation on what to prescribe that's safe during pregnancy and breastfeeding.
Isn't that so important for all of the like maternity deserts we have in the United States, not to mention other countries? Yeah. I
It's
actually did
really
use some PSI information when I was teaching in Kyrgyzstan. They also speak Russian. And so there was just like one thing on PSI that was in Russian. And I was able to supply that to my postpartum doula trainees. So,
amazing,
yeah,
amazing.
yeah. All right. So, I am not probably even going to do the PSI certificate. It's not going to happen. But I have some empathy for parents. And what I want to know is what low barrier tools can I give them that doesn't make me step out of my little circle, what the things that I do best. What can I help with?
You don't need to be an expert. There
Okay.
are experts out there, and there are more experts out there than used to be when I started in the field. So it's, to me, it's a very exciting time in this field that there are many more people
Mhm.
talking about it. So you don't need to be the expert. You need to be someone who's willing to have a conversation. Say to them, look, I've learned a little bit. I went to this wonderful podcast. I have this great brochure. I know of a website. Here's a couple of apps. Here are some tools that I can give you. And let's learn together what works for you and then make referrals. That's the best thing we could possibly do.
That's such good reassurance for me because I would not want to make a mistake,
No.
but I don't have to know everything. I can just do what you just said. So,
And the other thing is find therapists that you can call. I have psychiatrists that I call and I say, hey, this person's on this medication. What do you think? There's, by the way, a really wonderful website for medication during pregnancy and breastfeeding called Mother Risk.
okay. We'll put that in the show notes too, then.
I would definitely add that.
Okay.
So you can even look up, is this medication a teratogen or not? But you aren't prescribing. I always like to say it's the biggest gift that I can't prescribe because then I have to take that responsibility on.
Yep,
But
for
I
sure.
can say, I know somebody who knows more. And,
Mhm.
you're welcome to give people my contact information if anybody has questions. I'm happy to ask
Okay. We'll
them.
put your information on the show notes too, then.
So find a person that you can just talk to about it. There are consultation groups just for professionals like you and me that just want to say, gosh, I have a case. I saw Susie and this is what happened and this reminded me of this for me,
Mhm.
and I don't know what to do, and somebody can give you some pointers.
Yeah, yeah. And there's an organization called Prosper in my area, but it's just in my area, I believe. And they are a great resource for me too, as far as being able to give out information that somebody could just go to Prosper, or they have some like webinars for people who aren't going to be professionals, but just need some additional training.
Look in your area. Many areas now have resources that they didn't used to. You might
Mhm.
find a clinic, you might find a provider, you might find just even somebody who offers information or learning, and maybe even form your own little community.
Yeah, yeah, great idea. Great idea. And I know when I train other people to be doulas and childbirth educators, and when I'm talking, especially to the postpartum students, I say we had talked a little bit earlier in the podcast about people with little or no social support. And I keep thinking about that. I do train about that. And you brought it up, and I thought, well, when I do train people about that, I always say to them, it's great if you have a 3 week or a 6 week time to spend with this person with little or no social support. But what are they going to do when you're gone? And I always talk about that. You know, doulas are supposed to be working themselves out of a job. So creating the support system for them when you're gone by referrals, by getting them involved in PSI, by all of those things can really make a difference.
There's an approach to psychotherapy called interpersonal psychotherapy, which is one of the evidence-based approaches to working with perinatal patients. And one of the tools that I've adapted from them is this kind of circles. So you draw a circle and you draw a couple circles outside.
Mm-hmm.
Sit down with a family that you're working with and put a little X in the middle and say, hey, this is you. And let's name 5 people and put them in proximity to how
I love that.
you.
Yeah.
And be creative. Okay, well, this is, I really like the checker at the grocery store. She always asks me how I'm doing. I really feel comfortable with my mother-in-law, but I can't stand my mom. Like, what are the things that we put on there? So mom's going to be here, but mother-in-law might be here. And have them, it's a real visual to say, oh, I'm not alone. And put yourself on it, but exiting, right?
Right. Right.
If you're on the way out, it's like, okay, great, I'm here today, but let who might want to take that slot when I move out.
Mm-hmm. Yeah, that's a great. I'm a visual learner, and I can see and feel emotional too about how I can put that together.
Yeah,
excellent, very excellent. So, um, when we are working with parents, whether it's in the classroom, in the birth room, in their home, how can we become a safe space for them to really tell us what's going on? Are there things that, like, you have a superpower about that, but is there something you can give us?
Yeah. Part of it is, if I say to you, Debbie, trust me, that's not what builds trust. Trust is predictability, dependability, being honest, being forthright, and in some ways being able to tolerate uncomfortable situations. You do that, and you're open to that. I create space. If you're having a class and you're teaching and people are coming in and out and in and out, and you arrive late, you are not going to develop an environment in which people are going to feel safe to share.
Yeah.
But if you come in and say, I will always be here at 5 p.m. and I'm always going to come and I'm going to have and we keep talking about chamomile tea. I'm going to have chamomile tea here. I'm going to have seats here. I'm going to have brochures here. And you're going to come in, and I'm going to actually say the door has to be closed by 5:15, so that nobody feels that they're in the middle of sharing and it will feel disruptive or exposing.
Mm-hmm. Oh, yeah.
You provide that. You provide consistency, honesty, transparency, and you're 90% of the way there.
Okay. And I also feel like sometimes when I say, I don't know, so let's find it together, builds a stronger relationship.
Truly, because you're human and you're admitting that you're human, and you're not looking down at them and saying, well, yeah, I mean, this is an experience I've heard from people who go to their OB. The OB is like, I already mentioned that last week, or saying, you don't need to know that information. You'll find out when we get in the hospital. What does that do? That just now 90% of OBs don't do that, but I'm just saying I've heard everything. Mm-hmm. But anything that feels either dismissing or minimizing defeats trust.
Right.
So, but if you say, I think I might have mentioned it last time, but I think probably wasn't clear enough. Let me try it again. Let me share that again. Or I don't really have the answer. Your doctor may be the right person, but I'm going to help you phrase the right question to ask.
That's a perfect solution. So in a world that seems really stressful, how can we help parents find hope when they feel weighed down with stress? How can we gently remind them that this isn't going to last forever, without minimizing their feelings?
You remind me of a situation many years ago. I had a client who came in, and she was really, really struggling and really depressed, and she had twins, and she was just absolutely overwhelmed. And I said to her, This won't last forever. I know it, but you don't know it right now. So in the meantime, I'm just going to hold that belief and sit with you till we get there. And many months later, she said to me, when you were talking to me and you said, I know you're going to get better, I thought to myself, this poor lady thinks she's right, but she's wrong.
My goodness.
But she said, I really appreciate, and by the way, she did get better, right? But she said, I really appreciated that you said, even though you believed I would get better, you were going to be able to sit with me until it happened, or at least support me and acknowledge that I'm not better today. And I think this is a hard thing. We talk about those early months, those early years of parenting as the longest, shortest days.
Mhm.
Those days when you have a colicky baby, or when you're trapped inside with your baby, or you're feeling overwhelmed, or your nipples hurt from trying to breastfeed, and you just don't even know what day is up, and you haven't brushed your teeth in a week, and you're just wiped out. If I were to say to you, gosh, Debbie, this time goes so fast, you would punch me, right?
I
So
will. Yeah. Mhm.
it doesn't go fast when you're in it and it's stressful and overwhelming. And so be sensitive to those kind of comments, because the truth is, it only goes fast to somebody who's past it, not somebody in the moment. And so acknowledge that in the moment it can be hard, and there will come a time when it'll pass. And until then, they're not alone.
I do love that you said you're going to hold that. You're going to keep the optimism for her until she sees that she can thrive as a parent. I love that. I love it. So sometimes I think we birth workers need to hear the same thing, but yeah.
What we do. And the fact that we need to hear that from one another makes this whole conversation much more normalized and less stigmatized. It's
Mhm.
not that you need this because you're a problem. You need this because you're human, and this is hard.
Mhm. Yeah, yeah. Especially when you get home from a birth that didn't go the way the parents expected, and you're taking it all in as blame for yourself. And then your sister doula can say, hey, tell me the story and let's talk about the good things that you did. So something like that.
Yeah, being able to share the narrative of the experience and having somebody not say, well, let's fix it, or that's not the way it happened, but just to say, oof, I heard you when I took that in. That was hard.
Yeah. So sometimes we do take on that, what's happening with another family, or even we take on their stress, even if it didn't happen to us.
Mhm.
Maybe the dad is so stressed out he won't even come in from the garage anymore, and we're going home and we're feeling all the things that the mom felt. How can we identify that we can't own this stuff? We need to get rid of it.
You're going to wear yourself out too quickly if you
Mhm.
carry everything. And there's all a balance, because on some level, part of our job is to be present and to be there. So we have to feel it. Did you watch Mr. Rogers when you were a kid?
Sure. And when my kids were kids,
What does Mr. Rogers do when he comes home?
takes off his shoes, puts his jacket away, and puts his sweater on, puts on his comfy shoes.
Yeah.
Yeah.
Find a ritual that ends your day and your work, and you leave it behind.
Oh my gosh, I love that so much.
Find your Mr. Rogers.
Mhm.
What is it? It could be, this is another thing. I actually teach people to just brush it off. Oof, that was hard. I don't want to carry that anymore. I'm going to brush it off. Or I'm going to go home and I'm going to put my computer here. I'm going to put my, jacket here. I'm going to put my doula goggles here, and I'm going to go into my life and be like very intentional. It's not about just doing the action, but to say, I let go of this to be here now.
Yeah. And I think that works the opposite way too. If I've
Absolutely.
just been watching CNN and I'm like, "Ugh," and then I'm going to go help parents, I kind of have to like shuffle into their house and just get it all off me, take some breaths before I can go in and be as useful as possible to them.
And that's the truth is we're often driving and listening to the radio or a podcast, and we can go, oh my God, this global thing, whether it was the pandemic or a war or or something that is really upsetting to us, and we hear it. And if we go in with that energy, that's no good for anybody.
Mm-hmm.
So to just say, I'm turning it off, find the ritual. Maybe in my mind, I'm going to have an invisible knob that I turn it off. Turning off this knob.
I like it.
I'm going to put on my, change my hats and go outside.
That's great. Great. All right. We already talked a little bit about normalizing birth workers asking for help, and the fact that that helps us model to the parents. Do you think that we need to mention that we have asked for help to help them realize they can too, or not? Is that not where we should go?
So the question of self-disclosure is a big one. Here's what I like to say. Ask yourself the question, will this self-disclosure be of help to this person? And if you feel that it will be, here's the rule. Take a breath, share, and make it brief, and move back to the person. So if they say, well, I don't know, you're a caregiver, you probably never needed help in the past. And you can say, oh, but that's not true. I have needed help, and it has made a big difference for me. Let's go back to helping you ask for help.
Perfect. Perfect. A good frame for me to remember. I appreciate that. Yeah. So, all right. So I think that we've kind of been circling this, but as a perinatal professional, we need to be focused on what we can influence. You had mentioned it several times. We can't fix everything. And so instead of feeling bad about not being able to fix everything, how do we stay in that moment, in the moment of knowing what we can influence and passing that information on to the parents? Like, you got to kind of let go of that stuff out there and focus on what's happening in your house, what's happening in your birth. How do we do that?
It's the same thing. Control what you can and try to step back from the things you can't, or try to come up with other professionals, referrals, resources for the things you can't.
Mm-hmm. Mm-hmm.
So this goes back to the idea of medication. I can't prescribe medication, but I can refer.
Mm-hmm.
I can follow up and say, oh, your doctor told you this? Yeah, I know a lot about that medication, and I've seen people who've used it, and I think as long as you follow the doctor's recommendations, we're good. But constantly referring back to what's in our scope of practice. I can't say, that's not working. I think you should go up to X, Y, or Z. But I could say, if it's not working, talk to your doctor. Maybe there's something different that will work, right? So as long as you're saying what you can with, and you may not even be in that zone at all, so you might just say, this is beyond my scope, but I have a therapist who knows really a lot about this, and I'm going to reach out and see if either she has availability or referral, or at least a tip for you.
Mm-hmm. Mm-hmm. Yeah, that's good. And you reminded me that when I start my childbirth education class, I say, a lot of times I'm going to say, when you ask me a question, I'm going to say, that's a great question for your provider, because I do know where my circle is. I do know where I'm supposed to stay. And so I don't say the second part of that to them, but I think they then understand that I have my boundaries. I have the things that I do best, but so do the other people I'm going to refer them to.
And I think if you just do that second part of the phrase too, which is, would you like a pen and paper to write that question down so you don't forget it?
Yeah. Okay, good.
I think that's something you give them. It's like, I am taking this seriously and I'm not dismissing it. I'm just giving it to the person who has the answer.
Right. Perfect. Well, we're almost to the end of our podcast. How did we get there so fast? Like it seemed like a minute.
It really went quickly, and it's just so delightful to talk to somebody who does such important work. Thank
Yeah.
you.
And, I've learned and relearned so many things from your wisdom. Do you have any final thoughts for the listeners?
What I want to say is if you lead with your heart and you reach out to a team for yourself, you're doing important work, and don't forget it. But also start here. Take care of yourself first.
Thanks for that. Good wisdom.
Put on your oxygen mask on first.
Oh, I like that. I like that. Yeah. Okay. Well, thanks so much for being with us.
Oh, thanks for inviting me.
This episode of Incast is complete. Tune in regularly to hear more insightful conversations. And be sure to visit enjoyhealtheducation.com to see how Enjoy can help you inspire families and staff through our diverse childbirth and parenting teaching solutions. Or call us at 1-800-326-2082. The views and opinions expressed in this podcast are those of the guests and do not necessarily reflect the official position of Enjoy or its employees. This podcast is intended for informational and educational purposes only and does not serve as medical advice, a basis for diagnosis, or recommendation of treatment.